Let's talk about Rwanda. It's a true global success story in public health. But what happens when the very tools that got you all that success just hit a wall? Today, we're diving into how Rwanda is building its very own sovereign AI to shatter that wall and really define what's next in healthcare.
So here's our game plan. We'll start by understanding the unique spot Rwanda's in, a position of strength but facing a new kind of challenge. Then, we'll see this huge shift from thinking of AI as just another tool to seeing it as core national infrastructure. We'll break down the action-first engine that makes it all tick, see some real-world examples, and wrap up with how Rwanda is building a digital fortress to own its future. Now, it's super important to get this straight right from the start. This is not a story about a system in crisis. Not at all. Rwanda is starting from a place of incredible strength. I mean, they're hitting ambitious UNAIDS targets and have one of the highest life expectancies in the region.
Look at a number like this, 96% national child immunization. That just doesn't happen by accident, right? It's the result of really disciplined policy and, absolutely crucially, an amazing network of community health workers. But a number this high, well, it also reveals the next, even bigger challenge.
Because how do you get to 99%? That last few percent is just exponentially harder. You're trying to reach families in the most remote spots, manage the most complex cases. And the very digital tools that help them get this far, well, they've basically hit a hard ceiling. And that ceiling, it actually has a name, the digital health ceiling. It's that point where just adding more apps or running more little pilot projects, it just doesn't move the needle anymore. In fact, it can start creating more problems than it solves, overwhelming the very people it's supposed to be helping. And this ceiling is really built on four big barriers. You've got siloed systems that trap data. Imagine a doctor treating a kid for malaria who can't see their vaccination history. That's the kind of dangerous gap we're talking about. Then there's the crushing paperwork burden on health workers, the huge risks to your data with public AI, and the instability you get from this endless cycle of temporary pilot projects.
So this is about a completely different way of thinking. On the left, you see the pilot trap. It's a bunch of fragmented tools that kind of sit on the outside, can't really do anything, and just lock you into a vendor. But on the right, you have an infrastructure asset. This is something the nation owns and controls. It's embedded deep inside the core systems, and it's designed to execute real tasks. This isn't just a small tweak, it's a total philosophical shift.
This quote absolutely nails it. Remember cloud computing? It took managing servers from this huge, complicated headache to something reliable that you just plug into, like electricity. The goal here is to do the exact same thing for AI and national health operations. So how does this new infrastructure approach actually work? Well, it all starts with something called the action-first engine. You see, the biggest reason most AI pilots fail is because they're treated like chatbots. They can talk, but they can't actually do anything. Eagle AI is designed to be the complete opposite.
The action-first principle means this AI is built from the ground up to execute tasks, not just give you information. It doesn't just give you an answer. It triggers a referral. It updates a patient's record. It automates a whole workflow. It's built to be the automated connective tissue for the entire healthcare system.
And here's what that looks like in the real world. A community health worker, maybe out in a rural village. She reports a child's symptoms with just a simple voice note in her native Kinyarwanda. Instantly, the AI understands and structures that data, it detects a potential risk, automatically triggers a referral to the closest clinic, and it updates the national health database. And this all happens in minutes, not hours or days. Just think about the impact that speed has on a sick child's outcome.
Okay, so let's move from the concept to the reality. Let's look under the hood and see how this orchestration engine actually plays out day to day for the healthcare workers and patients all across Rwanda.
First, let's just appreciate the scale we're talking about. There are more than 50,000 community health workers who are the absolute backbone of this health system. So empowering them with even a small boost in efficiency, that creates a massive ripple effect across the entire country. A projected 70% cut in their manual record keeping. That right there is the power of this system. When you let a health worker report a complex case just by using their voice in their own language, you free up hours of their time from tedious paperwork. That is time they can now spend on what really matters, patient care.
Now let's talk about something really amazing, predicting the future. For epidemic surveillance, the system is constantly analyzing symptom data that's streaming in from all over the country. This lets the Ministry of Health shift from just reacting to an outbreak of, say, malaria or Marburg to actively anticipating it, seeing hotspots develop before they can ever peak.
And for maternal and child health, the system basically becomes a digital safety net. It creates this continuous, AI-monitored timeline for every single mother and child. It automatically sends reminders for appointments, it tracks milestones, and if a critical visit like an immunization is missed, it instantly escalates that case to a health worker. The goal is simple and so powerful. Make sure no one ever gets lost in the system.
Now, for any government, rolling out tech this powerful brings up a huge, non-negotiable question. How do you keep it secure? How do you make sure you fully own and control your nation's most sensitive data? This is where the whole digital fortress concept becomes absolutely critical.
First off, the system is built on something called a single-tenant architecture. The best way to think about it is like this. It's the difference between a custom-built private house and an apartment in some giant building. Rwanda's entire health AI system is deployed in its own isolated house. Their data never ever mixes with anyone else's. It's their own digital fortress, built just for them.
Second, and this is a deal breaker, there is zero data leakage. This means sensitive Rwandan patient data is never ever used to train some external global AI model. The intelligence that's built from their data belongs to Rwanda and to Rwanda alone. Period.
And finally, this all leads to the real prize: total ownership. The crucial thing to understand is that Rwanda isn't just renting a tool or creating some long-term dependency on a foreign company. They are building a permanent national asset, a sovereign capability that they control now and forever. This really brings us to a fundamental shift in how we think. For decades, global health has treated data as something passive, something you collect, store, and then maybe analyze later. This whole strategy is built on a new, revolutionary idea: that data can be an active, intelligent asset that takes action on behalf of people. And when you make that leap, well, it forces you to ask a new question. What ceilings are even left to break?